Hello everyone and welcome to Chat with Nene Alice. If this is your first time tuning in to Chat with Nene Alice, don't forget to like, don't forget to subscribe, and don't forget to send in your comments. Viewers, today I have with me in the studios Tina Davies. Tina Davies is the president for Cancer UK in Sierra Leone, and notwithstanding that, she has gotten a lot of accolades to her name. She received the Order of the British Empire in 2016, and this award is a prestigious award that was given to her by the Queen. And she also got the Order of the Roquelle quite recently in 2022 for the work she does in women and breast cancer. And she got another award from Diaspora Focus in 2020 on her work on women and breast cancer. And she received a gold award from the president in 2016 for the work for the work she did on the Ebola response as the head of the psychosocial care response in 2015. She is also a specialist on fertility and breast cancer care. And so, viewers, I have the pleasure with me today to have Tina Davies. And I don't know if I've said everything about you, Tina, but do you want to say hello to viewers and say maybe some of the things that I left? I know you received an award from the Women's Forum, which I have not talked about. She received the award from the Women's Forum in 2020 as well, for also the work she has done on women and breast cancer. So we have the pleasure to have Tina with us today in our studios. And Tina, can you say hi to viewers, and if you want to say a few words before we can get into the conversation?
Hello viewers, it's a pleasure having me here. And Nene Alice, I'd like to say I'm impressed.
Thank
and
you.
Congratulations for the great work you do.
I've
seen most of your clips. I log in your each time you're on.
Yeah.
You know, the awareness, the sensitization, you can't beat that.
Yeah.
I only hope that people appreciate her work and take it to a larger platform or higher levels to ensure that, a lot of people benefit from all the conversation being made on your program.
Thank you so much, Tina. I'm very much inspired by those few words. So let's just go into the conversation. I just want to say, how has it been for you? I know you've been working in Sierra Leone, you've been working in the UK. How has that, how have you been able to juggle between those two lives?
First of all, I'll say I'm privileged to be in two worlds.
Yeah.
Only when you know the other side, you're able to make informed decisions or comments. So it's different, not the same. The things we take for granted, opening the tap, getting what you want, just a phone call, you have a directory, you don't have to walk everywhere to get everything done. People know their mandates, their roles, But I keep saying that Sierra Leone's got a lot of potential. We will get there, not just in terms of leadership, talking about the national leadership, but in terms of our collective responsibility to support government's priorities in the country. We'll definitely get to where we have to be. Yeah.
Okay, so you received this prestigious award and lots of other awards, but I just want to pick on one of those, and that is the Order of the British Empire. What was that award about?
That's the OB. Yes, I must say I'm blushing and I'm blessed because you have to do things extraordinary to get that. You get vetted, like turn you around, shake you up, make sure there's no dirt on you before you can get that. The process. Until I watched the video, I realized the process is through that until it gets to the Queen to sign it.
Yeah.
I feel blessed and I feel proud of myself because even if a traffic accident or a parking ticket or something that you've had that you haven't addressed, you will not. So they really vet you to ensure that you are somebody of honor and dignity to get that. But that being said, in terms of my work in Ebola, head of psychosocial, supporting the children, the women, the gender aspect, and the OICC, which was the Observation Injury Care Center. Mind you, we always have the OIC, which was in terms of the interim care centers that we have in Sierra Leone. But the OICC basically was specifically for contact children with the support of UNICEF. We were able to achieve that. So, and we talk about the safe and dignified burial. Through the pillar, I pioneered that to ensure that families know where their loved ones are being buried. At least they have the opportunity, even at a distance, to say goodbye. So that was something that I'm pleased that we're able to achieve, although I learned a lot of things through that as well, in terms of religious aspect, how Muslims are being buried without having a plaque to, identify, and all of that stuff. But these are all experiences that, as I said, no textbook will teach you. What I learned in Sierra Leone, well, I would never say I wouldn't have learned in the UK, but then I would have just been in my role, as per se. But I had the opportunity to get into other roles, because being a nurse, first of all, the skills that you learned, especially when you're at the management level, these are transferable skills. You can do any job, you can work anywhere.
Yeah.
Especially that we have, like, in a situation like that, compassionate communication skills, how you interact with people, whether it's vulnerable or people at certain levels and stuff. So I think being a nurse is a blessing. And people who are nurses, they shouldn't say, I hear nurses say, I'm just a nurse. You're not just a nurse. Because you have a whole lot to provide to your community and your country as a whole, whichever, either in the UK or Sierra Leone.
Yeah. But you received other accolades as well on the work you do with women and breast cancer. How inspired have you been with those awards, and how have you been able to make a difference using those, engaging those platforms?
From the Women's Forum, I received the award for my work in cancer, and with the Order of the Rochelle, which I received from His Excellency the President, Julius Maada Bio, recently, the 2022 Independent Insignia. It's for my work in humanitarian and cancer work as well. So I am really inspired to do more to support these women, because things that we take for granted within our circle is not for granted for the other woman. You see women, they come to you, they have breast cancer, they are young. You advise them, you refer them. They will look at you. First thing they ask, how much is this? How much is this? Because they're thinking that, okay, if it's going to cost 5 million, they'll say to you, I have 3 children. I'm not going to spend 5 million on myself and leave my children hungry. So I'm sorry, I'd rather die, but I have to provide for my family. So we have a whole lot of such situations wherein if we don't come in to support, for instance, the Well Women through funding they have and other organizations, these women are going to die eventually because they haven't received any treatment. So these are the sort of things that a lot of people don't understand. Even in the UK, they'll tell you everything is online. If you go there, every information you want from every entity, as long as it's something for the public, it's there. But how many people know where to search? How many people know where to go? So this is wherein, Cancer UK Salon, we support people, access in terms of signposting them, information sharing, awareness raising, and support basically here. But in Sierra Leone, there is a whole lot that is required in Sierra Leone. And in relation to the Gold Award, obviously it was a mini insignia, but which it was actually, because it was done in the State House and we had medals and stuff. I really feel blessed having all of this, because not everyone gets recognized for what they do, and there are lots of good people out there who are doing fantastic work, but they haven't been privileged to be recognized. Well, I will say kudos to you for all you do out there. Some of us have been recognized. Doesn't mean that we're doing a lot more than you guys. I guess it's just opportunity that comes, and you're around, and based on your work, you get to be recognized.
So the thing I want to ask you about is related to your profession as somebody providing psychosocial care to people with breast cancer and all of that. But there's this particular thing that I want you to talk about. How does menopause and breast cancer, how are they related?
Oh, that's a whole new program to talk about that, Nene.
Yeah.
Because you cannot talk about in a hurry. obviously age. When it comes to cancer, age, in fact, is, the first risk factor in having any sort of cancers. And if you smoke, that's the risk of getting breast cancer. And if you have family history of breast cancer, that's the risk. And alcohol. So a whole lot of things as well put you at risk. Some people will say, well, I've been smoking, or my family's been smoking, never had that. They were lucky. But you may not be lucky. So this is what we need to look at. And then before we just go through that, because in terms of the breast cancer, if we're going to go through menopause and breast cancer, it's a whole thing that we'll save for another time.
Yeah, I know we need to have another conversation on that, but I just want you, just to give us just a small, understanding that both of them are linked, actually. The reason why I'm asking her is because both of us are going through...
Don't say that.
We're going through we're having some signs of menopause at this age that we are.
No, I'm only 25. Don't say that.
So, and for me, quite recently I have a breast cancer scare, which I had to run to her to give me some advice. I had to go through mammogram and all of that. But I realized that, when I went to my doctor, he told me, maybe because you're changing your hormones or you're going through, the word that we don't want to say, menopause. So maybe that's why you are having all of those scare. So that's why I wanted you, to give like few just tips so that women know that there is a link between breast cancer and menopause.
Well, there's a link between breast cancer and menopause, but more so is the link between, or the risk factor, which is age. When you're aging, that's when you go through menopause.
Yeah.
So for women, it's our hormones, our breast changes. So we just need to be breast aware. Know your breast. Your breast, your best friend.
Your best friend.
Know your breast. You know what's normal for you, and you're able to determine what's abnormal, basically. That's why we keep saying once a month, when you're not ovulating, when you're not having your menses, find one day and just check your breast. Mostly when you're in the shower or whilst you're, I know a lot of black women lubricate, but this conversation is not just for black women, lubricate their skin, moisturize their skin, you feel your breast, and feeling you don't go like that. Flat palms, and you go anti-clockwise, and you'll be able to know. And you can even see things, the nipple, first of all. If your nipple was out and it's inverted, nipple inversion. This is something you should be concerned about because there might be something at the back sucking it.
Yeah.
You see, it could be something benign, but this is a breast change that you need to report. Basically, if your nipple, you have a nipple discharge, it looks creamy or you have blood there, then this is something. But we're not going to go through all of that today because we have a lot to talk about. We have a lot to talk about cervical cancer and the HPV vaccine that's been rolled out in Sierra Leone. It should be rolled out, it should start rolling out on the 3rd of October. I would like to encourage mothers to ensure that their children get these vaccines. Because the vaccine, it is safe. A lot of children get there. In Sierra Leone at the moment, it's from age 10. So even if you're a teenager that you think that you need to have this vaccine, it reduces your risk. And when you talk about cervical cancer, again, women that have so many children, if you have, multiple pregnancies and the erosion that occurs, multiple sexual partners, but that's not what we're going to talk about today. Because then when you go, you have the HPV vaccine and you know that you're preventing your child, you're reducing her risk. Doesn't mean traditionally, or people might think that, oh yeah, it means that they can go ahead and have sex. That's got where eventually when they're having sex and unprotected sex, put them at risk. But then it's just protecting your child to ensure that cervical cancer is one less thing to worry about because prevention is better than cure. So these are the things that, we really need to educate our women, our children. So as much as we go into the children, we come into the women and we move to the men. Because in terms of prostate cancer, which is my passion, because my dad had prostate cancer, I must say, and interestingly, we had to go through everything. He was lucky. He was with me in the UK here. So he had the biopsies, he had the MRIs, he had the radiotherapy and all of that stuff. And one thing I could say to the men is that you can survive with prostate cancer, but die of a heart attack. Because prostate cancer, the treatment and stuff, all these myths and misconceptions, how you've been diagnosed and stuff like that. But when you're having problems, urinary problems, having it difficult to pass urine, or you cannot empty your bladder well, or you're having blood there, all of these things, urgency, You're in urgency. These are the things that it's not right. Somebody might think it might be about diabetes, but then you never know. So go to that doctor. First of all, what they will do, they will check your PSA. You see, there's a specific antigen to check if your prostate levels are high. And for Afro-Caribbean men, normally prostate levels, the PSA is higher anyway. But at a level where you think that, oh no, this is something that you need to, there are urologists out there that you can see. And coming to Cancer UK Salon, these are all the roles that activities we intend to carry on in Sierra Leone to ensure that underprivileged who cannot afford, we provide the awareness for them, the education for the young people as well, in universities, in schools, health awareness, things that you do that reduce your risk of having cancer, all forms of cancer, provide nutritional needs. So we assess, we do know that the underprivileged are not always, they don't have the right nutrition basically. How we can optimize their nutritional level to ensure that if they're going through chemotherapy or any form of cancer, they'll be able to survive it.
Yeah, so you talked about something, we're going back to breast cancer, that most women do not know their bra size. And that is one thing that gives you pain or gives you the scare that we've been talking about. So do you want to talk a little bit on that as well?
Sure. So basically, I'm full cup right now because of the age I'm in. But you know your bra size basically, and when you wear your bra size, you know that your boobs are not down. It's properly worn in the sense that you see, and some people, I know a whole lot of friends of mine who will say, oh, I can just wear no more anyway it fits me. Oh, now this tomorrow
I do get one.
Well, that's basically some breasts they put them in gear one, some got infrared, some got Bluetooth, because the way it's being projected in the face, depending on the outfit or the effect that the woman would want. But we need to know our bra sizes, especially for us that wear the bras that got the bone in. Because the wires in the bra, if it's digging into your side, and that's one of the reasons why they even recall people to assessment after you had your first mammogram, because all of these, unfortunately, you cannot see with your eye, but when you have a mammogram, that's an image, like an x-ray of your breast. You see all of these, it shows, and they'll call you again to see. And when you have a history, then they say, oh, okay, that's why it is. So we just have to take care of our breasts, basically. We moisturize and we moisturize our legs. We just make sure that once a month, when we're not, ovulating, whilst we're not having our periods, we know how to do them, We check our, axillary to ensure that no lymph nodes, our collarbone, no lymph nodes. But I think I'm going into breast teaching right now, which I don't want to do because I would like to talk about the holistic cancer aspect and the palliative care. This is one thing that it's really, really lacking in Sierra Leone, because the few pharmacies that have palliative care drugs is very expensive. How do we ensure people going through that journey go through it with dignity and not in pain at all? How do we provide affordable or even free palliative care drugs, opiates, for people in the end stage of cancer or people in palliative care of cancer? I've been supporting the Connaught Hospital palliative care team, I think 3 years in a row with palliative care drugs, providing Oromorph for them. I go there and the former palliative care doctor, Mary Bourne, who will log it in, and I'll often go into their office in Connaught Hospital, go through the ledger to ensure that they're actually utilizing them and it's not being sold. Because I gave it as a donation, which is free, and I expect that the intended beneficiaries will not have to pay a dime for it. So reason why I go in, I check the books, I see, because government does provide like morphine, MST, which is the slow release of morphine. But when it comes to cancers, really, Oromorph mostly is what works, and it's very expensive. So 3 years in a row, I've been doing lots of donations to them, donations to the cancer ward, but too, wherein you have cancer patients during COVID, taking all the message out there, mask, hand sanitizer, talking to them about social distancing or physical distancing whilst they're on their beds on the wards, and provide them little something just to keep them going whilst they're there. So this is something that I've been doing. And another thing that I don't talk much about, it's the Aberdeen Hospital. Aberdeen Hospital, which is built by Sea Coast Express, because I supported a lot in that project, because I was the coordinator for Kihama Road Hospital and Rokupa Hospital, now the current big hospitals there, and most of the hospitals in around the country in Sierra Leone, through my UNFPA consultancy there. So I was the coordinator, climbing scaffoldings, ensuring that things are done. So somebody just said to me, somebody was complaining about hospital bill, they don't know what to do. And they said, oh, ask Tina, you know, she's coordinating the hospital, she knows what the flow and stuff like that, because she's got a medical background. So I was asked to support, and that was pro bono. So supported them with everything, ensuring that they have an incinerator. And they were like, what's an incinerator? So well, if we have a labor ward, you need incinerator to dispose of, you know, the placenta and everything like that. So supported them. Now they have like a 8-bedded. They have 4 for postnatal or antenatal, 2 labor beds. They have for children and general, basically, in Aberdeen, which I was really instrumental in that, to support them in building that. And that's the very first facility in Aberdeen that provides services. People always mix up the services that Aberdeen women provide, because you have to be registered to them. You can't just go. But even you're unregistered, you go into labor, if you're around that area, you can go to the Aberdeen Hospital or Sea Coast Hospital, and they will provide these services for you. So I have, in my own way, supported a lot in activities that would develop and improve the lives or the health lives of Sierra Leoneans.
So I just want to talk what next for Tina, but I noticed that you have a lot of brochures that we should be looking at. This one is your body, intimacy and sex.
Because people think if they have cancer, they should not be having sex. Their emotions and their needs.
We also have.
Can I just finish with that one? Yeah. Because remember, you have a partner who's got needs, but how you communicate, and even with the partners, reading this to know how to go about it is very important.
Yeah, so there's this other one on secondary breast cancer information pack. That's it. So if you email info@breastcancercare.org.uk, you'll get more information on
everything that you need.
Everything is there.
And this is breast cancer in younger women. So just to know that not just older women get breast cancer. You might have a very strong family history of breast cancer. That's your mother, your aunt, on your father's side. But the thing is that in Africa, unfortunately, people die, we don't know what they died of.
Yeah.
So in terms of the genetics, you cannot just have it in Sierra Leone, but be breast aware, not just older women get breast cancer.
Okay, so there's this other one, your body, intimacy and sex.
Yes, that we just looked at that. And we're looking about menopause.
Yeah.
Symptoms and breast cancer.
Yes.
So, you know, there's always a mix-up in that. And I think we've discussed that.
Yeah.
How, you know, menopausal women should be very vigilant, because age is not on their side. The hormonal aspect of their breast, you know, changes. But this is the leaflet all about your breast. Know your breast. It's here. And I have like 20 boxes of all of these, because I'm having a breast cancer event on the 21st of October.
So you have to be there.
Waltham Cross Pavilion Shopping Centre, because the 21st of October is when the whole of UK use as a advocacy day, although advocacy goes year in, year out. But that particular day on October, that's when the UK will raise awareness, raise fund, lots of advocacy, and that's what I'll be doing in Waltham Cross Shopping Centre, the Pavilion. And we'll have raffle, hopefully we have dignitaries that will come, cupcake and all of that. But all of this information will be there, posters and everything for the events, to ensure that we provide services in the Waltham Cross area for women. But the men shouldn't feel, you know, despondent, because for me in Sierra Leone, because there's been a lot of work in breast cancer, although it's limited to Freetown, but I believe that there is a lot going on in terms of men. Just to say, Nene, that I spoke to Dr. Tibi Kamara, who is the rheologist in Sierra Leone. He told me that every week they see 2 to 3 new prostate cancers. Every week. And every week, that shows that, by 4, just giving you how many, 15 cancers. So going on, and we don't talk about that, you see. And these are the things we really need to, the men need to be aware of that. I spoke to Len Gordon Harris, who is a radiologist. He tells me about how many, rectal or prostate ultrasounds he gets to do per day. And all of these ones are positive prostate cancers, because the image will show that, the clinical impression will show that as well. So we need to be health or cancer in general aware. There is a lot Cancer UK Summit is going to bring to Sierra Leone in terms of informing people on radio, on TV, on social media. So basically, yes, supporting people.
Yeah. So watch the space.
Absolutely.
So watch the space.
Absolutely. Watch
so
the space.
You're doing a lot, and you've done a lot. So thank you so much, Tina, for gracing the stage with me today. And I'm so happy that you were able to give out a lot of information around cancer, the various types of cancer, particularly breast cancer. So thank you. And I just want us to
before we toast to that, just to say that for viewers, if you have any questions, please just put it on the comment side. Nene Alice will ensure that she contacts me, and I'll answer your questions. Yeah. Well, thank you so much for having me, and thank you for viewing this.
Thank
you. And
you.
Hopefully this has been very educational, informative for you.
Yeah.
Thank you.
So cheers to the work you're doing.
Thank you.
To good health, more wins, and hopefully we'll end cancer.
Well, we just know that this is just cranberry juice. Because if you're wondering that talking about cancer and you're talking about alcohol, this is no alcohol. It's just cranberry juice.
Yeah, but we just need to drink
into that.
To good health and to more friendship. Thank you.
To friendship. Thank you.
You need to drink. Thank you, viewers. And if this is your first time tuning in to Chat with Nene Alice, don't forget to like, don't forget to subscribe, and don't forget to send in your comments. Thank you, and we hope to have more of you in our platform.